Hope that answered your question.
All right, man.
Thank you.
All right, guys, we're talking prostate this morning. Affects a lot of black men on this fine Juneteenth morning. And we're here right now with our doctor. Dr. Kevin Billups is in the studio. Good morning to you, sir.
Morning.
And we are talking about prostate. So we got another question. And we just wanted to talk a little bit more before we get to that question, man, about the exam. Because like you said, it's the one thing, when you're in the barbershop and you're talking to the bros and you're just hanging out. That's the thing that everybody just has the problem with. They don't want to go in. They don't want to get, the finger. They don't want that. But you don't want prostate cancer either.
Exactly.
One of the two is going to be uncomfortable.
Right. That's exactly right. So if you have to look at it is getting the exam, getting the blood test is being proactive so you don't get prostate cancer. The exam itself, literally, it's 10 seconds or less. It's just so for a few seconds of discomfort, what you could pick up is huge. So that's what I try and tell men. And when they come in, if they're hesitant, I really just try and explain to them, this is what I'm doing. The exam does not take long, but not doing this, not getting that PSA blood test, things like that, then there's a much higher consequence. Sometimes I call it the cost of inaction. As men, we really tend to delay, but what is that costing us by not doing something?
And listen, the first time I got my exam, I was like, man, I don't want to do this. Because I knew he told me when it was when it was time for me to do it, he was like, we're going to do it this time. And I was like, man. But then you start thinking about people that have passed away and people that, your friends that have gone on, due to that. Like, I'm going to just take these 10 seconds and stretch out my life a little bit more. You know what I'm saying?
Is there some sort of determining factor or reason that you would go in and think it's your prostate? Is there a precondition or a pain or something that make you want to go and do that?
So, that's a great question. And here's why. A lot of times with prostate cancer, there is no early warning sign, right? Like the one caller called in and said, I'm having some urinary problems and that. Well, then certainly you should come in and get that checked. But the reality of it is with prostate cancer, you may not have a symptom. So the first symptom that you pick up may be that elevated blood test, the PSA, or an abnormal exam. So yeah, that's a little bit different there. That's why it's important. If you look at when should you really start getting checked for African American men or men with a family history of prostate cancer, it should be at age 40. You should start looking at that. If you have prostate cancer, if you're a man who has prostate cancer or family history, you should be letting your son know, for instance, that, hey, I have this. You are at increased risk. You need to be thinking that at age 40 that you should be getting this checked out. I'll be even more aggressive if it's an African American man with a family history. Then I may even say, well, you probably need to come in a little bit sooner to get this going.
So do older men over 40 have prostate cancer? Is it more prevalent in men over 40? Or it is anybody? So it's most prevalent when you get over the age of in the 60s, but don't let that fool you.
Right.
I see plenty of men in their 40s and 50s who have prostate cancer. So you really don't want to go by, I'm going to wait till I'm 60 to go in. Like I said, African American man, family, if or any man with a family history, father, brother, then you really want to start at age 40.
Now there is, from my understanding, I think I've seen the commercial where you can do the testing through your stool. Now, is that going to be just as effective as the actual exam?
Like yourself?
Like there's a company out there where you can do a stool sample and send it in and testing for things like that.
And then they was talking, and then when I saw the commercial, they was talked a lot about false positives.
Yeah.
And false negatives.
Is that for prostate though?
I would say, is that colon?
I think that was colon.
I think you're talking more colon.
It was colon.
There's some urine, potential urine tests for prostate, but still the standard right now is still to get that PSA blood test, and we can talk about that. PSA is not a perfect test because the PSA, that's the prostate specific antigen. That blood test, it can be elevated if you have a large prostate. So you might just have a big prostate. So it doesn't mean that you have cancer. It can be elevated if you have that inflammation, that prostatitis that I was talking about. But it could also be elevated with prostate cancer. So if your PSA is elevated, then that's a reason to take a further look.
What is PSA?
So PSA is called prostate-specific antigen.
Okay.
It's secreted by the prostate. If you look, there's a range. If you look at they'll say the normal is 0 to 4 in terms of the number. But you want to be a little careful of that because it depends on how old you are. So if you're a younger man and you're in your 40s or early 50s, then I don't necessarily go up to 4. If you were above 2.5, 3, I would follow you more carefully. If you're older, 60, 65, older, and your number's a little above 4, then I, again, would follow you. But then I might expect that because as you get older and your prostate grows, that number can go up.
Right.
So that's the reason why we also like to have you kind of come in on a yearly basis.
All right, guys. I know sometimes, hey, everything ain't going to be Crystal telling y'all jokes. Sometimes we may have a little bit of an uncomfortable conversation, but it's needed.
Necessary, very.
It's needed, man. People are checking out faster than they need to.
Yep.
And, that 10-second exam can have you on this earth another 30 years. You need to really consider the entire exam.
And you need to go once a year, correct?
Yes.
Once
At
a year.
least.
Yeah.
Minimum.
Once a year. And that way you can kind of follow. We can pick up if that PSA level, that blood test level goes up a certain amount, so it's better to stay on top of it.
Yeah, got a timeline.
All right, guys. Men's Health Awareness Month, guys. Stick around. We got more questions coming up. And you can chime in right now. If you got a question, you're in your car, you're listening at home on an app, you got a question, call in. 615-737-9292. Good morning.
Call in now and ask an expert. It's our expert of the week. Call 615-737-9292 and ask the expert now. On the Kenny Smoov Morning Show on 92Q.
92Q, good morning. Go ahead and ask the expert.
I don't know if this is make-believe or I just heard or false, but I heard once upon a time that a glow pill can be taken before a prostate exam so it can be examined by x-ray. Is that possible?
A glow pill as in like lights up glow pill?
Yeah,
I mean, this pill supposed to illuminate your digestive system. I don't know if it's the next day you take it one day, you come back the next day, and an x-ray can be taken instead of...
Okay, so you're talking... Yeah, so this is a whole different... So there may be something like that in terms of if you're getting an x-ray study, but we're just talking about the routine screening that you should have coming in to get your prostate examined. There are things...
Okay,
you can get things called...
The question I was asking is that even an alternative? I'm asking that question.
Well, that's not the way we would. So that would be part of a more extensive workup. There would have to be a reason for somebody getting that level of an exam. They must be suspicious of something, because the substance that you're talking about would be, getting an exam, like maybe like a PET scan or something that would light the prostate up. But that person has already been evaluated, so you're already in the medical. The medical chain.
I'm already
for that.
in the hospital.
Yeah,
I'm already in the hospital.
There's got to be stuff going on already to get that. So that could, they're different
That
tests.
answered my question.
Okay.
That answered my question.
Thank you.
Yes. You're welcome. You're welcome.
Bye-bye.
Thank you.
All right.
Bye-bye.
All right, appreciate you. So we've been doing Men's Health Awareness Month all month long. Dr. Billups, you've been a godsend, just giving us amazing information, straightforward talk, and it's because this is a tough conversation, I know, for a lot of men. Especially, I know you know this.
No, it's tough, but it's important. So I'm glad you all are doing. I'm glad you all are doing this, so we can make everybody aware of this.
So we need to get some information. People might be listening right now. They may want to do a consultation with you or connect with you. How do they go about doing that?
So the best way to reach me directly, the best email, it's info@heal90.com. info@heal90, all one word.com. The other way is if you go to the meharrymedicalgroup.com, that's the website, then you can see the different offices where I am, Total Health, and that's the other way to contact me. But if a message, use that email that I mentioned.
So any other nuggets you want to give us before we check out of here about, I know, be quiet, Crystal, about prostate cancer, the prostate, and what men can do to better their health?
Well, again, it's great that we're having this conversation. I think the best thing is to be proactive. We talked about African American men starting this at age 40. I think taking care of your overall health. I mentioned that the literature is very clear now on nutrition, lifestyle changes, lowering PSA levels, decreasing your risk of prostate cancer. Well, the good news for guys is that same concept that we talk about for prostate health, guess what? It also works for overall health. So helping decrease the risk of diabetes, cholesterol, being overweight, all of that. So I don't have a special plan for one. It's the same thing. So really taking better care of yourself is good going in. And if heaven forbid you do get prostate cancer and need treatments, you still do better if you're healthier. So that would probably be my take-home message.
All right, guys. Thank you, Dr. Billups. We appreciate you being in here with us today. On this fine Juneteenth, Ask the Expert right here on the Kenny Smoov Morning Show. Good morning.
Waking up with Kenny Smoov in the morning.